guys, welcome back to my channel. So today I wanted to do a video, really kind of a quick video on our birth plan. So I mentioned this in a vlog, I think it was in my, it was in my 34-week pregnancy update for you guys that I posted when I was 34 weeks pregnant. I'm not quite sure when this is going to go up. But one of the things that we did at my 34-week appointment was talk about our birth plan. I talked a little bit about what we decided in that video, but I have a few thoughts on the birth plan that I wanted to just kind of like put out there and just, I don't know, talk to you guys about to see if it would help anybody, any pregnant mamas, mamas that are trying to get pregnant, and just like what things to think about. So I had this idea kind of going into the last trimester of pregnancy about the birth plan and about, you know, like what you want and what you want in the delivery and like what you, how you envision it going and all of that good stuff. That's really what the birth plan is. The birth plan is like making a plan for the things that are important to you in labor and delivery, in the birth of your child, things that happen after, things that happen before, things that happen during, all that good stuff. And usually you'll do it with your partner, or you can just do it and then you like take it to your midwife, your doula, your OB, whoever you want, whoever's going to be kind of like running the birth essentially. And then they kind of scan it so the hospital has it, at least this is what ours does. They scan it so the hospital has it, but they go over it with you, make sure that you have everything there, bring up some things that you might want to think about, all that good stuff. So I actually saw this for the first time when I was really early in pregnancy. I remember following mamas early on in my first, later in my first trimester on Instagram and seeing them put together their birth plans. And I did not know what that was originally. I mean, you can kind of figure it out and deduce. It's a little bit self-explanatory, but at the same time, I was like, well, what do you have to decide? Like besides, you know, like pain intervention if you want that, or if you want natural, or things like that. I was like, what are the decisions to make? So I remember seeing things like delayed cord clamping and immediate skin-to-skin contact and no pain intervention and just all these different things. And I remember looking, like people posting stories about their birth plan and it being like typed pages and pages and pages of notes. And I was like, whoa, we have to do that. Like that seemed daunting. It seemed a little bit like, whoa, that's gonna take a lot of time. I don't even know what half of that stuff means. So we got our birth plan documents at about 30 weeks, I think, right around there. They gave us like a little packet that had some of the different ideas of things that you can include in your birth plan, things to think about for your birth plan. And we obviously go with midwives. You guys have heard me talk about our midwife all the time and our midwife clinic and all of our different midwives, but we see one, we have like a head midwife who knows us the best, who we're seeing from now until the end. So I am 35 weeks and 2 days when I'm filming this, so that you know where I am in my pregnancy when I'm filming this, because I'm not sure when this is gonna go up. Like I said, I'm recording a lot of things, a lot of baby videos and a lot of beauty videos to have up for you guys so that we can still keep our daily content, because I'm loving doing that so much and interacting with you guys. So anyway, we got our documents around 30 weeks. I looked at it and I remember just being really overwhelmed, thinking about all the things. I didn't even know what some of them meant. I didn't really know how to navigate it, and so I just said, you know, Tim and I will look at this in the coming weeks. They told us we didn't need to really bring it back till 34, 36 weeks. So we didn't look at it right away. I looked at it a little bit and I just kind of thought about it. I just kind of sat with it and I thought about it. And probably a week or so after we got the papers, I showed it to Tim and I just said, I want you to like take a look and see what this is. We'll take it to our 34-week appointment. And we did, and when I got there, basically we didn't create a birth plan, a detailed birth plan. I didn't type it up. I didn't even write it on the sheet. I wanted to talk to our midwife about our birth plan because this is my first pregnancy. I don't know everything that happens in birth. I don't know everything that could happen in birth. And the one thing that has really stuck with me throughout this entire pregnancy is the lack of control that you have over everything, your emotions, your hormones, the fact that you're growing this human. You have no control over how your body's doing that. It just does it. It knows how to do it. You have no control over anything. Like pregnancy, I tell people, one of the first things I tell people when they ask about pregnancy or when they ask for advice or anything like that, I say, if you are a control freak and you like control, you're going to get a crash course in surrendering and trusting and in letting go. And that has been what these past 9 months have been for me. It has been an absolute course in completely surrendering. I love the quote by Gabby Bernstein, when you think you've surrendered, surrender more. It's in, I think, The Universe Has Your Back is where I think that quote plays a role in her book. But I always have that kind of in the back of my mind throughout this pregnancy and in life. I mean, I thought that I knew how to let go and release control and just, you know, be kind of free from the fear of needing to control everything, because control really stems from fear of being out of control, right? And control is also an illusion, and we could get into a long conversation about that, but we won't. So anyway, pregnancy has been even more of a shock of you really don't have control over anything. Your body, even the foods that you want to eat, the foods you crave, the foods that taste really bad to you, the pain that's happening in your body, the growth that's happening in your body, your hormonal changes, your emotions, your mental, your physical, you have no control. And so this whole pregnancy, I have been doing meditations for that, to surrender and let go and just like release myself from the need to control, because anytime that I would start getting into that pattern of like, okay, well, I have to plan this or control this, things would kind of like implode a little bit for me. Like mentally, specifically, I would just kind of get myself all worked up and a little bit anxious, and I would not be enjoying that. And so I've really been trying to surrender and let go. And so that was really my approach with my birth plan. And I'm making this video because I think it's so important to realize during pregnancy that your body was made to do this, and we have to trust that it's all happening how it's supposed to, and that it's going to be okay, and it's all going to be in the right timing and happen as it's meant to happen. And that's something that I've just like really had to adopt, because I would not have gotten through this pregnancy without it. Without that mindset, you can think so much about everything that could go wrong, because it seems like there are endless amount of things that can go wrong. And when you hear different horror stories of people talking about what happened with their labor and delivery or what happened throughout their pregnancy, you can like take those on as your own thing. And I have just really tried to detach from any possible outcome, from any scenario that I like imagine it being. That's not to say that I don't picture my baby girl being really healthy, or that I don't say mantra like I am healthy and this baby is healthy, or I'm going to have a healthy baby. I love affirmations, and I've been doing like that one every day for a while now. It just like reassures me that everything's going to be okay, that when she comes it's going to be in the perfect timing and it's all going to be fine and all of that. And I just have to keep telling myself that, and that's something that you have to do in pregnancy. And so when I approached the birth plan, that's really how I approached it. So there's absolutely nothing wrong to approaching this in any way. I just wanted to give you guys how I looked at it and how I saw it and what was helpful for me in my pregnancy. I know myself, and I'm a naturally anxious person. I don't like taking medication. I don't like pain medication. I don't like any kind of medication. I have a very sensitive system, and I respond very sensitively to it. I obviously take it when I need it. Don't get me wrong. I'm not like anti-medicine, but I just like to, I'm more a naturalist and more of a minimalist when it comes to medical intervention. So I did always want to birth at a hospital. That was really important to me, which is why we chose a midwife clinic that births at hospitals. And I wanted to have the medical, like pain intervention, all of that, and surgical equipment, all of that available to me. That makes me feel reassured. So that was a part of it. But when I approached my birth plan, I wanted to approach it with the same mindset that I've really approached this entire pregnancy with, which is that when, like, you know that joke, how to make God laugh is tell him your plans. And I know from this whole thing that I am not in control of this. And I know myself, and I know that if I made a very detailed birth plan of exactly what I wanted to happen and really thought out every little piece of it, I would attach to certain parts of that, and it would upset me if those didn't happen. I just know that about myself. And so putting together this birth plan was another exercise in being able to let go of the process of it and letting my body run this show, letting her run the show, knowing that it's all going to be okay, because it's going to happen how it is meant to happen. And so there are a few things that I did want, and there's absolutely nothing wrong with like wanting certain things in your birth plan. Absolutely nothing wrong. There's definitely things to think about. But for me, this was I didn't want to put a lot in my birth plan. I wanted to put a few things that were really important to me, and then I wanted to very clearly make it known that I'm not attached to these things, that if they don't happen, my ego is out of it. And that's what I keep telling people when they ask me if I'm nervous for labor and delivery and all of that. Sorry, George is growling. There's a deer. Hey, let's stop, George. It's enough. It's enough. I didn't want to be attached to my birth plan in a way that it would upset me or bother me if certain things didn't happen. So with this long-winded kind of message about myself, about how I look at all of this and look at this pregnancy, in our birth plan, the things that were important to us that we did put is that I would prefer to have a natural delivery. I keep telling everybody that I'm completely taking my ego out of all of this. Out of pregnancy for one, out of birth, out of labor, out of delivery, out of all of it. My ego is not involved. So when we get there, it's about, for me, it's about dropping into like my infinite self, dropping into my soul center, dropping into my body, listening to what it wants, and communicating that clearly to our midwives, to our nurses, and all of that, and about what's happening and what I want. And I know that in that moment, what's most important is that I be listening to my body, listening to my baby, and not being attached to a particular plan. With all that being said, there are a few things in our birth plan that I would love to have happen, ideally. I also recognize this would be an ideal situation, and generally that's what a birth plan is. And they say that birth plans, not to attach them, like your midwife, your doctor, your OB, will tell you a lot of times, if you have a really detailed birth plan, you should prepare for this to not go exactly as it is. Like, don't be attached to this plan, because so many times it does not go that way. So a few things that we really wanted that are important to us right now, we'll see what happens on the day, but are that I would love to attempt a natural delivery, and that means without pain intervention. So our hospital does have 3 different types of pain intervention, and nitrous oxide, but it's a very low blend of it. So like the dentist is like an 80-20 mix of nitrous and oxygen or whatever it's called. And the hospital uses a 50-50 blend. So the dentist it like stays in your system, and at the hospital you inhale it in and you exhale out. It really doesn't take out the pain, it just kind of take away the pain, it just distracts you from it. So there's that, IV narcotics, and epidurals. Those are kind of the 3 different versions of pain, and IV narcotics are usually fentanyl. That can have, there have been different scientific studies that have shown that IV narcotics, when you get them, they go not only to you but to your baby, and so they can make your baby kind of tired and things like that. But the biggest effect that I believe happens with IV narcotics, or can happen, not all the time, but it can make it very, very hard to breastfeed, because the babies can have a hard time just like getting into the rhythm of breastfeeding a lot of times. So so anyway, that's like a little bit about IV narcotics. I didn't actually know that. We took a labor and delivery class and we learned a bunch of stuff, and then our midwife shares all that with us too. So anyway, those are 3 different pain intervention things, and I would like to have a birth without any pain intervention. So that is one thing, but I also am open to pain intervention. I have no idea what labor and delivery and this pain is going to feel like, and I don't want to commit like wholly and fully and be hell-bent on having a natural delivery, because I don't want then to be so attached to that I can't be open-minded if it's so bad that I'm just anxious and I can't enjoy the process, and I'm like freaking out and panicking because the pain is so bad. So like I said, ego is taking a backseat in all of this for me, and I'm just going to be listening to my body. So I would love to have a natural birth without pain intervention, but we're gonna just see what happens. So that was one thing. Another thing that we wanted as part of our birth plan is delayed cord clamping, which actually is a practice that our hospital already does. That is natural protocol, and you will find that at some hospitals that they do delay cord clamping. Basically, when you deliver the baby, they have the umbilical cord, which is full of like blood vessels. That's how like from the placenta, it's attached to the placenta and the baby, and the placenta is obviously attached to you. And it's how like the blood and all of the nutrients and everything is getting to the baby. And so when the baby is born, sometimes they'll cut the cord right away and you know, give you the baby. But a lot of times now they delay cord clamping, because just by a few minutes, usually like 3 to 7 minutes, until all the blood is out of the umbilical cord and into the baby. So that makes it so that the baby is getting all the nutrients, all the blood that it needs and that it had in the womb outside. So it can help prevent kind of low iron in babies and anemia, things like that. And there are a lot of things that delayed cord clamping is really good for. Our hospital actually already practices that. So we didn't have to even put delayed cord clamping in our birth plan, but that is something that we wanted to do. The one like con or downside is that it can raise bilirubin levels. Being connected and not having it clamped right away it can raise bilirubin levels in babies, which can cause jaundice. But the benefits of delayed cord clamping to us and to our midwives and our hospital far outweigh like any risk. Jaundice is, you know, like a yellowing of the skin, and so they usually can go under a light. I actually was jaundiced as a baby. And so anyway, so that is something that we also want to have in there. We didn't have to put it in because our hospital already practices it, which is really cool. So you can learn more about that if you want to look it up. That was something that I remember seeing in people's birth plans, and I was like, what the heck is delayed cord clamping? What does that even mean? The other part of our birth plan is I want immediate skin-to-skin contact after the baby is born, and that is very good. Very, very, very good and very helpful for regulating baby's temperature right away, regulating my temperature, the instant bond and connection, and it also is linked to being really good for breastfeeding. It's just like having that connection, baby and mom, right away is so important, especially in that first hour, and like starting and breastfeeding within the first hour. Yeah, so sometimes that's not possible, but usually it is, and with delayed cord clamping, they just pull the baby out and they put it on your stomach, and if usually the cord, or put it on your chest, and if the cord is not long enough, they'll just put the baby a little bit lower on your belly, but they can still do immediate skin-to-skin with delayed cord clamping. So immediate skin-to-skin was really important to me, and if for some reason I cannot do immediate skin-to-skin and something else is happening, or I had a C-section, I would want Tim to be doing immediate skin-to-skin contact. So that is part of our birth plan as well. A really seemingly basic part of our birth plan that is very important to me is for my nurses, my midwives, everybody to be very direct with me. I don't want things happening around me that are not being communicated to me or to Tim. This kind of is something that goes without saying, but it's also a way to put in your birth plan how you respond. So if you're somebody who is kind of like ignorance is bliss, things scare you a little bit, you don't want to know a lot, maybe you want them to be, you know, really like gentle with you and kind of sugarcoat it a little bit, which our midwife said some people really like doing. Maybe you want them to be really direct and be like, this is what's happening, these are your choices, like we need to make a decision, blah, blah. And that's me. I cannot handle it. Like if nurses are coming in and doing things and I don't know what they're doing, I'm gonna be anxious. So it was very important for me to have in my birth plan that I want them to be very clear, very direct. Obviously, I have to consent to everything, so it kind of goes without saying that they have to communicate with me. They would do that anyway. And my husband, another part is that no tests on baby or nothing done to baby without Tim or I present, which is also another practice at our hospital, so it wasn't really a big thing we had to add into the birth plan. But your birth plan is also a really great way to just advocate for yourself, advocate for how you respond to different environments, how you want your atmosphere to be in labor and delivery, how you want them to communicate with you and your husband and your baby and all of that. And so in there I put that I want a very calming atmosphere. I'm gonna have my crystals, we'll have music, maybe you want like a really happy, positive, upbeat, like Beyonce concert vibe birth, and I definitely want like very happy, positive, and also calming. Like I want the room to be very calm. And yeah, so anyway, I put that in the birth plan as well. Just kind of the atmosphere and the general feel of the birth that I wanted to have. And then I think the last part, I'm trying to think if there's anything I missed with any of that. I don't think so. Tim is gonna cut the cord, that's in our birth plan. And then the other three things that happen soon after your baby is born are they offer a vitamin K shot, which helps with clotting in your baby because babies are born without a specific clotting factor. And so it can be kind of grave if the baby has a bleed. And our midwife recommended doing that. So we are going to be opting in for the vitamin K shot. We are deferring the hepatitis B shot. I do not have hepatitis B, my husband does not have hepatitis B, and it is sexually transmitted and bloodborne. So if neither of us have it, our baby cannot have it. Like there's no risk for our baby to have it or get it. And so because of that, neither Tim or I are comfortable on day 1 or 2 giving her a vaccine. Our midwife said there's really no need for it that early. And if we had like multiple partners or things like that, it might be necessary. it probably would be necessary, but it's just my husband and I. Neither of us have hepatitis B, and so she can't have hepatitis B. So we're deferring that to her 2-month shots. We are vaccinating our child, but we're not going to be doing that on day 1 or 2. It's just not necessary, and we don't want to we want to let her come into the world in a way that, you know, she wants to, and let her be comfortable and not be inflicting any more on her. And the shock to her system of being outside of the womb and in this new world with like all these bright lights and all these doctors and her parents and all of that, we don't want to be doing more to her than is necessary. We want that adjustment to be like really beautiful and really, you know, as easy as possible, and so we are not going to be doing hepatitis B. The other thing that we're not going to be doing is the ointment that they put on their eyes. It's like a cream that they put on their eyes, and it is for gonorrhea and chlamydia. I've actually been screened, I think twice for gonorrhea and chlamydia. Because I've had a couple infections this pregnancy, and you can just get them when you're pregnant, like yeast infections or bacterial infections, and I've had a couple, and so generally they always screen you for that. But I don't have chlamydia or gonorrhea, neither does my husband, and so she's not at risk for contracting that, and so that's why they do the eye ointment. So that's just not something that we need. It would be unnecessary treatment, and so we are not going to be doing that as well. And I believe that is really it for our birth plan. I know this was a long-winded video. I thought this was going to be really short. I truly did, but it turned out that I had a lot more to say than I thought I did. I just want you guys to think about your birth plan in the way that it is going to be best for you. Every birth plan doesn't need to be the same. They don't even need to be similar, and you don't need to pick out every little detail. Do what's right for you. Do what feels right to you, to your baby, to your partner, to your family, and just think about that, because after seeing all these like really detailed birth plans on Instagram and that being kind of what I was going into it with, I felt like we had to have this crazy detailed birth plan. And the day that we went in, I just said to Karen, I sat down, I said, listen, like, to me, I do not want a detailed birth plan. There are a few things that we would like to have happen, but it would make me feel attached and semi in control to create this super detailed birth plan and have it all go differently. And I said, so truly, I come in with an open mind and open heart, and with the knowledge and the understanding that the most important thing for me is to listen to my body, listen to my baby, communicate that clearly, and go from there. And you guys know the few things that, if it's possible, that we would love to have in it. These are the things, and we'll go from there. And so that's how I approached it. I wanted to give you guys all of that, just wisdom, things to think about. I don't know, whatever you want to call it. I love you guys, and if you like seeing these kind of baby videos, I know this was like a very specific like birth plan video, but hopefully you still enjoyed it and it gave you some ideas for your own birth plan, or gave you ideas into something to think about when you do get pregnant and have to go through some of this, or not have to, but are going through and get to go through this. So yeah, give this video a thumbs up if you're enjoying the baby videos, and I think that's it. I love you guys so much. Have a great day, and I will see you all in my next video. Mwah.